All right, as mentioned, we are so happy to have Christina to present the housing program for with disability, family and individual with disability. It's such an honor to have Christina here.
Thank you very much for having me this evening. My name is Christina Geller. I work for the Maryland Department of Disabilities. I work specifically for a program that's called Maryland Partnership for Affordable Housing, which is a combination of the Maryland Department of Health, the Department of Housing and Community Development, and the Maryland Department of Disabilities. And we all work together on a few housing initiatives, which I will go over this evening. I have a little PowerPoint that I'm going to use, so I will share my screen. And all right, and we'll get started. Okay. So I'm going to review a few programs that the Maryland Department of Disabilities manages a wait list for. And as I mentioned, this is a partnership for affordable housing. And these are a lot of the agencies that are also involved, but it is definitely set up by the Department of Health, the Department of Housing and Community Development, and then the Department of Disabilities. And we believe that people control where and with whom they live. We want everyone to be in an inclusive community and that they can choose the best support to meet their goals and needs, and the environment supports the person. So just want to go over a few definitions. So in our housing world, housing affordability is considered a household paying 30% of their monthly income for rent, mortgage, and that's the rent and utilities combined. You'll hear me talk about the area median income, which is the middle point between the lowest and highest household income within a defined area. Fair market rent, which is FMR, is the HUD standard for rent in a local area. And that can be by county within a jurisdiction, and it can even be narrowed down into certain zip codes, and the rent can change throughout those areas. Household, any adults and children living in a dwelling, and that could also include I'm sorry, it does not include authorized live-in aides. They are not considered household members. They technically would not have any rights of tenancy for the unit or the home that you're living in. And we'll talk about public housing, or public housing authority, a PHA. They typically are known for administering Section 8 vouchers, which are now called housing choice vouchers. They also own public housing. So you may be familiar with project-based housing, and they may own other housing within their portfolio that they rent out through programs. This is just a little bit of data that we've collected, and it gets updated every couple of years, and they recently did one for 2023 and 2024. But as you can see here in 2024, the SSI standard payment is $943 a month. And so that's roughly about 99,000 people in Maryland who are currently living with a disability and have SSI income. In Maryland alone, the number of renter households that have 30%, that are below 30% of the area median income, is 194,641 households. And that makes up 26% of all of the households in Maryland. And as you can see, on average, just a one-bedroom unit in Maryland is roughly around $1,358, which is 167% of their SSI payment. And just to kind of narrow that down even more, a household or an individual for a two-bedroom unit would need to have average wage of $31.08 to be able to afford a two-bedroom unit, which is the 10th highest in the nation. And that roughly works out to be around $13.25 an hour to be able to afford just a one-bedroom unit. and having to work 79 hours a week to be able to afford that rent. So we also talk about permanent supportive housing in our housing goals. So what that means is housing is separate from services. The supports and services are offered, but they are not required within our programs to have the opportunity to rent. Again, highly encouraged, but not a requirement. The person controls where and with whom they live, and the housing is always integrated in the community within like multifamily housing projects. So we like to work with the individuals on our wait list and the case managers to help apply for services, applying for SSI, and looking at their credit, looking at their budget, looking at their criminal history, when all those background checks are done, making a housing plan, finding staff that'll be able to support them in the community if they're moving from a nursing facility or a group home situation. We have a couple of resources that we use for individuals that are applying for our programs. We like to use the Consumer Financial Protection Bureau. They have it's several chapters for Your Money, Your Goals. They actually have all of them on YouTube, each chapter. And one of the nice things that they have in their program is specific goals as it relates to budgeting. They have pamphlets for people with disabilities, repairing their credit. They also have sections on their website for filing and for filing if you think you have been issues with your credit card, or if you think that there are things on your credit report that are incorrect, or if you are a victim of identity theft. So they do have a lot of nice programs. They have free information, free flyers. They have free trainings that you can attend as well. And then we also, the FDIC, which is the Federal Deposit Insurance Corporation, they have a Money Spark program as well. So when we have case managers that enter the applications onto the wait list. So the case manager could be a support planner, a coordinator of community service, community health worker, resource coordinator. They are lots of different individuals that can add people into the wait list, but we ask them to kind of look at all the information that needs to be gathered before they enter that. So what's the person's income? Where would they like to live? Do they need to be close to public transportation and shopping and medical facilities? And what size unit do they need to be in? Do they need any special features like accessibility, like grab bars or lowered countertops? Maybe they need features in their unit. If they are deaf, they could have special light switches, or lights that blink for the doorbells, things like that. And then having a conversation to identify those barriers to housing, like a criminal background check, or poor credit history, or even poor rental history. Some of our housing strategies where they bundle housing and services would be considered things that happen through the Developmental Disability Administration. So at DDA, they have community living group homes, they have shared living, and then we also have residential supports through the Behavioral Health Administration, such as a residential rehab program. So it'd be group homes for people with significant mental health disabilities. And the priority is for people with forensic issues where maybe they have something court ordered. A community living group home, which is available through the Developmental Disability Administration. The services are funded by DDA, but the housing is not. And in order to be in a group home, you must be receiving services through the Community Pathways Waiver. Housing is controlled by the service provider, so it's usually owned or leased by that service provider, and it does make your choice on where to live and with whom you live. Those choices are very limited when it comes to those types of things. A shared living host home is another situation where you would have to be enrolled in the community pathways waiver through the Developmental Disability Administration. And the person lives with a caregiver in the caregiver's home. The caregiver is trained to provide those supports. And it's very similar to individuals who are in adult foster care. Housing is separate from services. So like a family home, rented room, apartment or house, or home ownership. DDA services can be used when renting your own home, like personal supports, and then supported living, which would be up to 24 hours of awake supervision. The services are provided by an agency licensed by DDA, such as the ARC, maybe Jubilee, service providers like that from DDA. Typically, most people know about two types of rental subsidy programs: the tenant-based rental programs, which are usually vouchers, or Section 8. Everybody still calls it Section 8, but it's really a housing choice voucher program. Those are tenant-based programs, and that's where the tenant, the participant who has been awarded that voucher locates their own housing where the voucher has been issued from. So let's say Howard County is where the individual received their voucher through the Howard County Housing Authority. They would be able to locate housing within Howard County. And because this program is considered tenant-based and the assistance is really attached to the person, that voucher becomes portable. So if the individual decides to move, and that could just be, for example, moving from Howard County to, say, Prince George's County, that subsidy, that rental assistance that they're receiving through the voucher moves with the person. Compared to project-based rental assistance, which is what Section 811 and the Weinberg apartment programs, which I'm going to talk about a little bit later, those programs are considered project-based. And that means that the rental subsidy that helps pay the rent is tied to the unit. So it's actually tied to like the bricks and mortar of the building. And in order to receive the assistance, the individual must live in that unit that is participating in that program or that project-based unit. And again, so tenant-based is usually the Housing Choice Voucher, Section 8. We also have a program called Bridge Subsidy, and project-based is the Weinberg or the HUD Section 811 program. This just goes a little bit into more detail about tenant-based assistance through that Section 8 voucher. It's HUD Rent Subsidy Program. It administered by a local public housing authority, PHA. Household pays 30% of their total household income for rent and utilities, and then that voucher pays the rest. This program will provide an extra bedroom for a living caregiver or for medical equipment, as long as there is documentation to verify the need for those things, but there's no additional rent. So you wouldn't be paying more money for a 2-bedroom. You would still be paying 30% of your household income for that unit. Housing choice vouchers, I would tell everybody to apply as soon as you can, but you have to be 18 to get onto the wait list and even to be offered that voucher, because the individual is signing a lease. So they have to be over 18. You can apply at your local public housing authority where you wish to live, or where you currently live or where you currently work. Usually priority is given to individuals with a work-live preference for that housing authority. There's a link here that shares all of the public housing authorities in Maryland. If you're submitting an application, make sure that you have a secondary contact on your application so that if the name comes up on their wait list for a housing opportunity for that voucher, they have multiple ways of getting in touch with you. And I would tell everybody to remember their login when they create that account so that they can go in there and update it when any personal information changes, when it comes to their contact information, email, address, telephone number, things like that. The Housing Authority wait lists that are typically always open, Montgomery County and Anne Arundel County, those wait lists are usually open all the time. As for the other housing authorities, they typically do advertising. For Baltimore City, I've seen bus ads, I've seen billboards throughout the city when they start to announce, get ready to announce that they're going to open their wait list for a period of time. If you're looking for affordable housing, we have a couple of websites that we use. Go Section 8 is a big one if you have a voucher and you're looking for properties that accept vouchers. We also have a website called mdhousingsearch.org, which is a website that Maryland landlords who accept low-income housing tax credits to make units affordable for individuals. They are supposed to register all of their units there, as well as anybody else in the state of Maryland that has a unit that they wish to rent to anyone. They can list that on there. Public housing authorities may have other information about maybe project-based units if they don't have vouchers, and then realtors, newspapers, Craigslist, Facebook Marketplace. You might be able to find ads for rentals, but proceed with caution when it comes to Craigslist and Facebook. Make sure that it's not a scam. So I'm going to go over a little bit of information specifically about the Weinberg Apartments program, which is one of the wait lists that we manage. This was a program that was developed with the state of Maryland. The money was provided to us by the Harry and Jeanette Weinberg Foundation. This is administered through that Maryland Partnership for Affordable Housing. The initial grant that we received was $2 million, and that created 20 units. It serves households that have between 15 and 30% of the area median income. All units are currently occupied for that funding. Then we received an additional $2 million in August of 2016. That goal was to create 15 units, and that was to target households that had income between 10 and 30% of the area median income. We have 9 units identified with 6 that are currently under construction. So this program is, the eligibility for this program is for individuals who are disabled and currently receiving SSI or SSDI cash payment benefits. The total gross household income needs to be between 10 and 30% of the area median income in which the county they want to live in. We do not run background checks prior to individuals getting onto the wait list. However, 2 of the questions that are always asked during the application process for the wait list is if a household or if the applicant is a lifetime sex offense registry requirement, or if they have been convicted of producing methamphetamine on federally assisted property. If either of those questions are answered yes, then the application would not be able to move forward onto the wait list. And this program, individuals pay 30% of their total household income for rent and a portion of the utilities. This wait list, everybody's application that comes into the wait list is date and time stamped. And so what we look at when we have housing opportunities that become available through this program is we look at the location of the unit and those with the greatest need. And so by the greatest need, we look at these factors that are listed below for Does the household have a need for accessible housing? Is the person, do they have multiple disabilities? What's the health, safety, and well-being of the applicant? And if the applicant has children in the household, was the person currently residing in a nursing facility or a state residential center or a state hospital? Were they homeless? Were they at risk of having one of these things happen? And then we look at eligibility and access to voluntary long-term supports and services, their readiness to move, and then the date and time stamp of the application. When it comes to selecting the units that participate in the program, developers have to have financing that comes through the Department of Housing and Community Development, and they also have to have a nonprofit involvement. The HUD Section 811 project rental assistance. So we've received 3 awards in total from HUD, the Department of Housing and Urban Development. The first award that we received was in 2013, and that was for $11 million. And in 2015, we received 10 million. And I'm sorry, I just realized that I did not update this with the money that we received in 2019. So I'm sorry, in 2019, we did receive a third award for almost $9 million. So this slide is incorrect, and I will update and resend it to you guys if you want to send it out. So it's a total of 30 million for all 3 awards. And the first award is for these specific counties that are listed at the top of the slide. And they all had to be within the Baltimore, Washington metropolitan statistical area. And then the second and third awards were for the entire state of Maryland. They could be placed anywhere. This one is, again, another project-based program. The units are typically located in multifamily housing developments, and these are integrated units. So no more than 25% of the units can be set aside for people with disabilities. And that 25% not only includes the Section 811 program, it could also include any other special population programs that the property is participating in. Individuals, in order to get onto the wait list, again, have to be between 18 and 61, and the leaseholder needs to sign their lease, the original lease, before they turn 62. If they turn 62 while they're housed, they can age in place. They don't lose their housing. They can remain in the unit, but that original first lease that they signed to get into the unit has to be signed before they turn 61. An individual needs to be disabled as defined by HUD. They need to be receiving Medicaid or medical assistance, and they need to be eligible for the long-term supports and services associated with Medicaid. Typically, individuals that are on our wait list are at SSI level of income or lower, but still need to be within that 30% of the area median income in the county that they would like to reside in. And this has the same requirement for that background check of the production of methamphetamines or the lifetime sex offense registry. And same thing as Weinberg, households pay 30% of income, 30% of their total household income for rent and a portion of the utilities. The Section 811 program does have a priority population when it comes to housing opportunities. So when we become aware of a unit that is available through the Section 811 program, our first priority group that we house from is individuals that are residing in that are institutionalized. So it's institutionalized individuals who are receiving Medicare or Medicaid or medical assistance. And that's typically, those institutions are considered a nursing facility, a state residential center for individuals with intellectual disability, a state psychiatric hospital, or a chronic hospital. Our second priority group are individuals who are at risk of being institutionalized because of their current housing situation. So it could be that they're unable to leave their home. due to a health change, and now their home is no longer accessible, or they could be living in substandard housing, deplorable housing conditions. And because of those housing conditions, they're no longer able to have supports and services from maybe one of the maybe a community options waiver or community first choice, some type of Medicaid program. The supports are no longer able to come into the home because of those conditions. Our third priority group are individuals who are moving to independent renting, and they are either moving out of a DDA Community Pathways Waiver Group home, a brain injury waiver, alternative living unit, a behavioral health residential rehab program, or an assisted living facility that is licensed by the Office of Healthcare Quality. And then our fourth group is our homeless population. And within the homeless population, it is subcategorized and they are defined by the Hearth Act. So it's actually homeless, imminent risk of homelessness, into families who are unaccompanied youth with families and families with youth, and individuals who are fleeing domestic violence. This is our the 2024 income thresholds, and this is right off of HUD's website for area median incomes. This is not all of the jurisdictions in Maryland. This is just kind of a general overview. So on average in Baltimore, the area median income is $122,200. But a one-person household with 30% cannot exceed 25,700, and a two-person household cannot exceed 29,350. And then typically, and so that the Baltimore metropolitan area usually consists of Baltimore County, Baltimore City, Anne Arundel, Hartford, Carroll, those counties. The Washington D.C. metro area is usually Howard, Frederick, Prince George's, Montgomery. Their area median income is 154,700, and a one-person household cannot exceed 32,500, and a two-person household cannot exceed 37,150. And then the statewide non-metro area median income for Maryland is 87,800. I have a couple of slides here that go into the long-term supports and services for this one is for the Developmental Disability Administration, and their Medicaid waivers that they have are the Community Pathways waiver, and they have the Family Supports waiver and Community Supports waiver. These are DDA state funded services. I'm sorry, they also have DDA state funded services, and those are for individuals who are not enrolled in one of the waivers listed below. Other long-term supports and services that could be through, there are other Medicaid waivers. There's the community options waiver, the brain injury waiver, and a medical daycare waiver. There are also state plan services, which include community first choice, community personal assistance services, and increased community services. The Department of Disabilities has an attended care program. Behavioral Health Administration, they have PRPs, which is a psychiatric rehab program, ACT, which is a certification, ACT team. Now I'm trying to remember the acronym. I'm sorry. Assertive case management. I'm sorry. But and then they have targeted case management. The Centers for Independent Living also provide some long-term supports and services. They do provide Section 811 case management services, as well as independent living skills. So for the Section 811 and the Weinberg Apartments program, those the wait list and referrals are managed by the Department of Disabilities. Applications have to be submitted by an individual's case manager, coordinator of community service, support planner, community health worker, resource coordinator. There's a variety of terms that are used for what we call case managers, kind of an umbrella term. But it's typically anyone that is assisting an individual with applying for the supports and services that they need to live in the community. The applications have to go onto the wait list, which is a secure secure screening tool that we use for the wait list through a company called Emphasis. Case managers pre-screen the individuals to see what programs that they're eligible for, and then add them to the wait list as appropriate. For the Section 811, we look when we know of a housing opportunity that becomes available, we sort our wait list from the area that the unit is in. And then those priority groups that I went through, we start our outreach and we go in priority order. And then within each priority status, there's a date and time stamp of the application. We always have suggested case managers. We give them this list of documentation that they need to make sure that an individual has so that they're ready to go when it comes time to apply for housing. These are things that everybody's going to need no matter what they're applying for, whether they're going to rent an apartment, they're going to buy a house. These are just documents that people always need: a birth certificate, a valid government issued ID. Sometimes people don't have that and they need a passport, and passports will work, but anyone over the age of 18 that's in a household that's going to be applying for housing is going to need that ID. A social security card, proof of citizenship if applicable. If there are children in the household, custody, if that's necessary, or documentation from the court showing the custody or guardianship for that child. And if somebody is divorced, or the divorce decree or the separation agreement, again, if that's applicable to that household. Again, these are things that should always be ready to go. And they're a Social Security award letter usually doesn't take too long to get. But I can tell you that I have not worked with a housing provider, property management company that will not accept a Social Security award letter that's more than 60 days old. So they're always going to want something updated. And if an individual has applied for SSI or SSDI and they've been denied, or they're in the appeal process, any of that documentation from Social Security to show that they don't have income is also helpful to the property management company. If somebody in the household is working, has earned income, the property is going to want 6 most recent pay stubs, consecutive pay stubs. If they have a pension, a recent statement. If they're self-employed, 2 years of tax returns. And if somebody has any type of retirement account, they're going to want statements from those. Documentation, if anyone has held a mortgage on or is currently holding a mortgage on a property, and along with rental insurance, even if they're renting the property. 6 most recent statements from a checking account. Some people don't have a checking account and they get their Social Security money on a direct express card. So a recent receipt from an ATM machine is necessary to show the balance in that account. Any statements as it relates to savings accounts, retirement plans, IRAs. If an individual or someone in the household receives temporary disability or temporary assistance for needy family, the documentation is going to be needed from the Department of Human Services or DSS to show what is being received. If child support is being received, documentation, not only documentation that they're receiving it, but documentation if they're not receiving it. So both are needed in either situation. We try our best to tenant training for everyone that is housed through our programs, because we want to support everyone to make sure that they are successful in their tenancy. And so, I mean, it's making sure that households understand the lease, they understand the program. We want to make sure that the rent has been calculated correctly. We want them to understand how to make those rent and utility payments, and how to work with property managers, making sure we go over the community rules so that there's no lease violations, helping them resolve any tenant issues that come up at the property or with the property management company. And if they decide that they don't want to reside in that unit or within the program, how to end their tenancy. And then making sure that they have a housing backup plan should something happen that they're not able to stay in their unit. We have 2 manuals that we offer. Families can use these, can review them. We provide them to all the case managers, and then we provide the tenant training manual to individuals who end up being housed in the program, and then the case management manual for case managers that want to add their clients onto the wait list. Home ownership is always a possibility, and there are a couple of programs for individuals. Owning a home does not affect your Medicaid, your SSI, or your SSDI benefits. It can be owned by the person or a special needs trust. And then there's a link here for more information from SSI. And there's also a program for the Maryland Home Mobility Program for people with disabilities. And there's a link for that as well for more information. There is a special needs trust and home ownership program through the Maryland, a publication was issued from the Maryland Developmental Disabilities Council for Planning Now. And then there's information about the Special Needs Alliance if you're going to create a trust. I don't know if anybody's familiar with the ABLE accounts in housing. So it used to be called Maryland 529. Now it's called Maryland ABLE. The federal law states that account funds should be disregarded for purpose of means tested federal programs. ABLE accounts shall be considered a resource of the designated beneficiary to the extent that such amount exceeds 100,000. The expenses for mortgage and rent must be paid in the same calendar year, or I'm sorry, calendar month that the funds are withdrawn from the ABLE account. And it can be used for housing related expenses, mortgage, property taxes, rent, utilities, sewer, and garbage removal. Just a little bit of information about fair housing and reasonable accommodations. There are federal fair housing laws. There are 7 protected classes: race, color, religion, gender, familial status, national origin, and disability. Nationwide, people with disabilities experience the most frequent fair housing violations. We also do provide a training to case managers and property managers as well on fair housing and reasonable accommodations. MDOD actually has a YouTube channel, and a lot of those trainings have been recorded. So if you're interested in learning more about fair housing and reasonable accommodations, there are trainings available out there. So some examples could be refusing to rent to someone only because they have an intellectual disability, charging someone a higher rent or security deposit because of their disabilities, refusing to allow someone with a disability to use any of the amenities, denying eligibility to a supportive housing program because the applicant is blind. So those are just some examples of some fair housing violations that we have seen over the years. A reasonable accommodation is a change, exception, or adjustment to a rule, policy, practice, or service that may be necessary for a person with a disability to have an equal opportunity to use and enjoy a dwelling like everyone else in the community. Reasonable accommodations require a housing provider to do more. They must make changes in rules, procedures, policies, practices, or services if necessary to afford a person with a disability equal opportunity to use and enjoy a dwelling. So some examples, getting and staying on a wait list, missing deadlines, missing documentations, inability to apply in person or attend an interview. A reasonable accommodation could be related to a criminal or a credit or rental history. Um, you would need a reasonable accommodation if you needed to ask for a live-in aid, or even a service or emotional support animal if the property is um, if they are not a pet-friendly community. Um, if, say, an individual has a voucher and they are searching for a unit, they could request a reasonable accommodation to have more search time, and maybe even possibly asking for additional bedrooms for because of their disability. There's also reasonable modifications, and these are different. These are structural changes to housing. Um, so it could be things like making the unit accessible and adding accessibility features to the unit, so that an individual can benefit from the housing, and reside in the community comfortably, just like everyone else. Examples could be adding a ramp to allow access to the dwelling through an exterior door, grab bars in the bathroom, lever door handles. I went over a couple of these earlier. So things like having specialized alarms or in the unit if they have a vision or hearing impairment, lowered light switches, lowered cabinets. If someone uses a wheelchair and needs to have the cabinet in the bathroom removed underneath the sink so that they can wheel right up to the sink. Those are types of things that a reasonable modification would allow for. And so I have added our contact information. My name is at the bottom. My supervisor, Shar McCready, who is the Director of Housing Policy and Programs, her information is on top there. That's our email and our phone number. So if you have questions or need more information, we are happy to assist with getting that information for you guys.